Hi, I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Thank you so much for all your messages of support. I really appreciate them. And I'm so pleased that so many of you have found the breathing exercises video so very useful. Today what I'm going to do is I'm going to demonstrate those exercises and I'm going to answer your questions. So what position should you do the exercises in? Is it valuable doing the exercises lying on your tummy over some pillows? Should you be doing breath holds? Should you be breathing in and out of your nose or your mouth? How often you should be doing them and how many repetitions you should do when you do them. So first of all, what I'd like you to do is sit down in an upright position. If you're unwell and in bed, the best thing to do is to make sure that you've got lots of pillows propping you up so that you're in a nice supported upright position. That's because we know that you get best air, in the maximum amount of air into the bottom of your lungs if you're in an upright position. And you may remember that in the last video I explained that you've got lots and lots of blood vessels in the bottom of your lungs, and therefore if you get the air to the bottom of your lungs, you get maximum oxygen into your blood and maximum carbon dioxide out of your blood, and that's what it's all about. Now it might be that if you're in hospital, your doctor, nurse or physiotherapist might advise you to get into different positions, for example, lying on your tummy over some pillows, and by all means, of course, follow their advice. However, for those of you watching this at home, make sure that you do the exercises sitting upright because that will give you the maximum benefit. So let's get cracking. Put your hand over your diaphragm. Now, your diaphragm helps to bring the air into the bottom of your lungs. So if you just first of all note what it feels like as you just gently breathe. So as you breathe out, you'll notice that your hand moves closer to your body, and as you breathe in, your hand moves away from your body. Likewise, if you put your hands over the sides of your rib cage, so don't forget that your lungs fill up the whole of your rib cage all the way down to the bottom, all the way around the back. So you place your hands over the sides of your rib cage, and you notice that as you breathe in, the sides of your rib cage move away from your body, and as you breathe out, the sides of your rib cage move back in again. So just take a few gentle breaths, so about 3 gentle breaths in and out. Now we're going to move on to the deep breaths. Now, ideally, it would be good if you could do this breathing in and out through your nose, because there are additional benefits from breathing in and out through your nose. However, if you are breathless, then that's going to be really quite tricky, and that's fine. Don't panic about not being able to breathe through your nose. Just breathe through your mouth. You'll still get really excellent benefits from doing this breathing exercise. So I'm going to focus on your exhalation, so breathing out, and you're going to try and make your exhalation longer. So you're going to try and breathe out, and then you'll notice that you'll inhale, so you'll breathe in as a reflex, because breathing in is a reflex, breathing out is not. So as you focus on breathing out for longer, you'll then notice that as you breathe in and you take a deeper breath in, you're able to fill the bottoms of your lungs more and more, and as you keep breathing into that deep inhalation, when you get to the top, you just pause. You don't try and force extra air into your lungs, you just have a little pause at the end of that inhalation, and then you breathe out again. Breathe out, and through your nose, breathing out, breathe out, breathe out. It can be useful to visualize your lungs like a sponge, so your lungs being a sort of spongy tissue. As you breathe out, you want to try and wring the sponge, so as if you're trying to get water out of a sponge. So as you breathe out, you're squeezing the air out of the bottom of those spongy lungs to try and really get all of that carbon dioxide out of your body. And then take a deep breath in again, and then hold at the end of that inhalation and breathe out again. So you want to do 3 deep breaths out and in, and then you want to return to your normal gentle breathing. It's important that you don't do more than 3 deep breaths, otherwise you'll become lightheaded and you may well faint. So just do 3 deep breaths and then return to your normal breathing. Now, Ideally, the more frequent that you do this exercise, the better. And particularly if you're unwell and in bed and you're not up and moving, then it's particularly important that you do it very frequently. So try and do it whenever you're awake. Try and do 3 deep breaths and then some nice gentle breathing. I hope that's been helpful. Please do follow me on my YouTube channel, so just click on the subscribe button. I'm going to be producing more videos over the next few weeks and months on how to keep you and your family healthy over the coming weeks and months. So I look forward to seeing you next time. Bye.